This video is in memory of actor and producer Chadwick Boseman, who died at the age of 43 years due to colorectal cancer. Colorectal cancers are cancers that develop in the colon, also known as the large bowel, or the rectum. They occur due to an uncontrolled growth of cells in the lining of the colon or the rectum. These abnormal growths often begin as polyps. A polyp is a projection from the lining of the colon or the rectum that projects into the lumen. Not all polyps become cancer, and those that do usually take several years to do so. Colorectal cancer is a serious condition, but there are several treatment options for this. If you would like to know more about the anatomy of the large bowel, you can watch the video on lower GI endoscopy. The exact cause of colorectal cancer is not known. There are, however, some factors that may increase your risk. People over the age of 50 years are at a higher risk than younger individuals. If you have had polyps or cancer, you will be at a higher risk of developing cancer, even if these were completely removed. Diseases like ulcerative colitis and Crohn's disease will also increase the risk of colorectal cancer. If you have family members who have developed cancer in their colon or the rectum, especially before the age of 60 years, you are at a higher risk. Some genetic conditions will also increase the risk of colon or rectal cancer. Diets that are low in fiber or high in fat or red meat will also increase the risk. Individuals who do not exercise regularly, who are obese or overweight, are at a higher risk, as are people who smoke or consume excessive amounts of alcohol. Most people with early colorectal cancer do not have symptoms. Symptoms generally occur as the cancer advances. When a cancer causes symptoms, there are some common symptoms you may develop. A change in your bowel habits. This might be a change in the number of times you go, or a change in the texture or the size of your stool. Blood in your stool or dark colored stool, or pain in your abdomen. If you would like to know more about these symptoms, you can see the individual videos in the links given. The cancer can spread to other parts of the body. This is known as metastasis. Common sites for colorectal cancer to spread include the liver, lungs, and the spine. If you get metastasis, you may develop pain in your upper abdomen, a long-standing cough, or severe backache. If the cancer blocks the colon, you may develop intestinal obstruction. If your doctor suspects a cancer, he may suggest a test known as a colonoscopy. During this test, a doctor inserts a long, flexible tube with a camera at its tip to look inside the colon and to take biopsies. The video on lower GI endoscopy includes a lot of information on this, and you can watch it by clicking on the link below. If a cancer is identified, you will need additional tests to assess the spread of the cancer. The spread of the cancer is known as the stage of the disease. The additional tests you need include CT scans, MRI scans, and some blood tests. The definitive management of a patient with cancer in the colon or the rectum is often surgery. Depending on the stage and the location of the cancer, you may require chemotherapy and radiotherapy. Some people will require chemotherapy and radiotherapy before surgery, and this is known as neoadjuvant therapy. Most people will require chemotherapy after their surgery, and this is known as adjuvant therapy. During surgery, the cancerous part of the bowel will be removed with its blood supply and the lymph nodes. Often, the remaining ends of the bowel can be reconnected immediately. This means that you will continue to have your bowel movements normally through your back passage. Occasionally, it may not be safe to join the two ends up in the initial surgery. If this occurs, the surgeon will create a colostomy. You will need to wear a bag over the colostomy to collect stool. This colostomy is often temporary, and you will soon have a second surgery to reconnect the ends of bowel. Rarely, especially if the cancer is in the lower part of the rectum, the patient may require a permanent colostomy to safely remove the cancer completely. If you would like to know more about colostomies or other types of stomas, you can watch the video in the link below. Surgery for cancer in the colon or the rectum can be done as both open surgery as well as laparoscopic surgery. After completing your treatment, you will be followed up regularly to look for features indicating a recurrence of the cancer. This will include meeting the doctor regularly, having periodic CT scans, colonoscopies, and blood tests. Having a cancer in the colon or the rectum may mean that your family members are at a higher risk of the same disease. This is especially true if the person developed the cancer before the age of 60 years. Some genetic conditions may also increase the risk. These conditions often increase polyps in the colon. If your doctor suspects that your family members may be at a higher risk, he may recommend genetic testing or colonoscopies. If you would like to know more about this or have any questions, please leave a comment below. You could also comment on any topics you would like me to cover in the future. Thank you.